VJ trends. Direct question ku poirலாம். Abnormal proliferation of uterine endometrial tissue outside the uterus is known as. The options are Metrorrhagia Manorragia, Endometriosis, Cystic fibrosis. The answer is endometriosis. What is endometriosis? Endometriosis, abnormal proliferation of uterine endometrial tissue outside of the uterus, like ovaries, fallopian tube, and intestine. Metrorrhagia is a condition uterine bleeding at irregular interval, particularly between expecting menstrual bleeding. Menorrhagia, which is heavy and prolonged bleeding. Cystic fibrosis, that is life-threatening disease which is affect the lungs and stomach. Which of the following is not a clinical manifestation of diabetes mellitus? Hypernatremia, Polyphagia, Hyperglycemia, Glycosuria. The answer is hypernatremia. Hypernatremia is a high concentration of sodium in the blood. And what is polyphagia? It is excessive eating, that is increased appetite. And hyperglycemia, it is increased glucose level. Glycosuria, it is excess of sugar in urine. Lactulose is prescribed for patient with encephalopathy too. The options are decrease the serum ammonia buildup, increase the protein level, decrease the bilirubin level, increase the glucose level. The answer is decrease the serum ammonia buildup. What is hepatic encephalopathy? That is loss of brain function because damaged liver does not eliminate the toxins properly. That is why the brain will develop encephalopathy. Hepatic encephalopathy generally occur people with severe liver disease like cirrhosis of liver. Then what is lactulose? Lactulose, which is synthetic sugar for treating constipation. The content of lactulose will help the large intestine to pull out the water from the body. Through this, the toxins ammonia also eliminated. Which of the following is used as an antidote of organophospharous poisoning? The options are Atrophin, Adrenaline, Avil, amiodarone. About Atrophin. Atrophin is an anticholinergic, antispasmodic drug which is a part of emergency drug. Atrophin increases the heart rate while treating cardiac arrest patient, and it is also act as an antidote of organophospharous poisoning. Adrenaline also used for emergency condition to treat the increased blood pressure and increased glucose level, etc. Avil tablet contain phenyramine maleate which is treat allergic condition like runny nose and itchy skin. Amiodarone, it is an antiarrhythmic drug which is used to treat the cardiac arrhythmias. The answer is Atrophin. Severe allergic reaction to a drug is known as. The options are interaction, toxicity, anaphylactic, adverse. First, what is interaction? Interaction is one drug alter the pharmacological effects of another drug, that is called interaction. Toxicity, that is poisoning. Anaphylactic, it is a severe allergic reaction to a drug. Adverse, that is unfavorable action of particular drug. The answer is anaphylactic. How much percentage of flow of oxygen in a red color Venturi mask? The options are 31% and 6 liters per minute, that is orange color, 60% and 15 liters per minute, that is green color, 40% and 10 liters per minute, that is red color, 35% and 8 liters per minute, yellow color. The answer is 40% and 10 liters per minute. Apical pulse is assessed by placing a diaphragm of the stethoscope as an area of. The options are mitral area, pulmonic area, aortic area, tricuspid area. How to check the mitral area? Near the apex of the heart, between the 5th and 6th intercostal space, that is apex of the heart. And how to check the pulmonic area, that is second and third intercostal space, left sternal border. And how to assess the aortic area, that is second and third intercostal space at the right sternal border. And how to assess the tricuspid area, third, fourth, fifth and sixth intercostal space at left sternal border. The answer is mitral area. Which of the following indicates normal intraocular pressure? The options are 19 to 38 mmHg, 8 to 22 mmHg, 20 to 35 mmHg, 16 to 25 mmHg. Intraocular pressure means fluid pressure of the eye. The answer is 8 to 22 mmHg. In which of the following usually have a dumping syndrome as a complication? The options are colectomy, nephrectomy, subtotal gastrectomy and hysterectomy. Dumping syndrome. It is a group of symptoms. The symptoms are diarrhea, vomiting, lightheadedness, tired after a meal, that are caused by rapid gastric emptying. Food moves quickly from stomach to duodenum, that is causes dumping syndrome. Colectomy is a removal of all or part of colon. Nephrectomy, it is removal of part of kidney. And subtotal gastrectomy is removal of part of stomach. And hysterectomy is a removal of uterus. The answer is subtotal gastrectomy. Which of the following is a manifestation of pyloric stenosis? The options are projectile vomiting, regurgitation, steatorrhea and tenesmus. What is pyloric stenosis? That is narrow opening between stomach and duodenum. Projectile vomiting, when your body expels vomit with more force than usual. Regurgitation, it is occur when undigested food rises from the esophagus. Steatorrhea, that means reduces the absorption of fat by the intestine, which leads to excretion of abnormal quantities of fat in the feces. And tenesmus, it is feeling of passing stools even after emptying the bowel, which is a sign of inflammatory bowel disease. And what is the answer is projectile vomiting. இந்த வீடியோ பிடிச்சிருந்ததுனா லைக் பண்ணுங்க, ஷேர் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, மறக்காம கமெண்ட் பண்ணுங்க. Thank you for watching.